Hi, I'm Dr. Rachel Venable, and I'm a veterinary oncologist. And today we're going to talk about what is melanoma. Melanoma actually in dogs more often happens in the mouth, which is strange, right? In people, typically we think of it happening on our skin, usually related to the sun. If that's why we wear all our sunscreen and hats and things to block, because melanoma is one of those terrible things that could happen. But in dogs, actually more often occurs in the mouth. A lot of times we see it in breeds that already have dark pigment, so that black mouth. And sometimes we can see it on the skin, and then it could be related to sun exposure, but usually those aren't as aggressive. Now, there's always exceptions to that, but normally the ones on the skin aren't as aggressive. The ones in the mouth, though, unfortunately, can be quite aggressive. So what does this look like? Well, you might notice an actual growth in your pet's mouth. Usually it's black, but not always. It could kind of be like the one in the picture here, where it's almost like a pinkish flesh type color. You might notice that their appetite's down or that they're eating funny. So sometimes it's hard to know, well, do they just have a bad tooth? Do they need to get a dental cleaning, or is there something more going on in there? Sometimes you'll see blood like on their food or in the water bowl or maybe on their toys. So again, kind of make you wonder like, there's something happening in the mouth. And then a lot of times really bad breath. I know, not all our dogs' mouths smell like roses, but when they have these tumors, they can get a lot of bacteria stuck on that tumor. And then sometimes these tumors can actually outgrow their blood supply. And so they have a really strong odor. So if your pet has a really strong breath, it doesn't necessarily mean that there's a tumor in there, but it certainly means you need a dental probably, and that you need your vet to take a look at the mouth and see what's going on. So what is your vet going to do? Well, to diagnose melanoma, you actually need a biopsy. So it does need to be a small surgical procedure. Typically what happens is, people are seeing those signs like what I mentioned. And so they go see their vet. They schedule to have a dental done. And then while they're having that dental and the vet gets a great look at their mouth, they also see that tumor in there. And so while they're in there, a lot of times they'll either remove that mass and send it into the lab to figure out what it is, or take a small piece of it if they don't think they can totally remove it. Once they send it to the lab, the pathologist looks at it under the microscope and they can tell us what it is and also how aggressive it looks. Typically, though, melanoma, like again, when it's in the mouth, it's usually quite aggressive. And so we do want to check these guys. We want to do what's called staging, and that's to see, is it anywhere else in the body? So a lot of times we'll check the local lymph nodes, which for the mouth are usually right under the jaw. We usually actually check both sides because it could go to either or, doesn't necessarily mean it'll be on the side that the tumor is. And in a lymph node aspirate, it's a pretty non-invasive thing. We just take a small needle, like what we use to collect blood, poke in that lymph node, and then we're actually able to send it out to the lab where they can look at it under the microscope. We also want to look at the lungs, so doing chest x-rays. Again, pretty non-invasive tests. We just have them lay on their side so we can snap those pictures to see how do things look on the inside. Because if there is spread to the lymph node or to the lungs, that can change prognosis and also what we would recommend treatment-wise. Speaking of, what are the treatments? Well, there's actually several different treatments. And as I said, when it occurs in the mouth, it's aggressive. So usually we have to do more aggressive type treatments to treat that. So surgery is ideal. And the type of surgery, sometimes it can be rather big. Sometimes it can be even removing part of that jaw, which is a big surgery. But our animals actually tolerate it really well. It's always shocking to me how well they do, because I wouldn't expect myself to recover so quickly. But it is something, to think about if that's what your vet, thinks that's going on. If your pet's diagnosed with a melanoma, I strongly recommend that you see a veterinary oncologist. They can also help guide you through, all what kind of treatments does your pet need? Do you need one of those big surgeries or not? Sometimes we'll do radiation. So radiation can also help treat that tumor. It's a local treatment. And then also something that came out a few years ago is called the melanoma vaccine. It's kind of exciting. It uses the immune system to treat the tumor. So it's more for preventing spread of the disease. It doesn't do so much for the tumor itself. You need to do those other treatments first, but the vaccine can help prevent spread. Other thing to remember, it's called a vaccine because it uses the immune system. It's not a vaccine that your pet should have been getting its whole life to try to prevent these. Unfortunately, we don't have that. This is called a vaccine because it uses the immune system. So some clients can get quite confused. Pet owners, they hear vaccine and think, why wasn't he getting this all along? But it's unfortunately, it's not that type of vaccine. Again, the skin, if your dog has a melanoma in the skin, a lot of times surgery is enough. Again, there's always exceptions to the rule. Sometimes they can be aggressive on the skin, but most of the time, just removing them and you should be fine. So remember, check us out on our website at petcancercareconsulting.com, where you can actually partner with a veterinary oncologist to get more information about what your pet's cancer is, testing, treatment, prognosis, and we can also partner with your family vet to help guide any therapy as well as follow-up. Also, check out our blog where you can find a lot more information on melanomas and get more detail. And remember, let's all try to help our pets get the care they deserve.